how diamine oxidase deficiency may create different symptoms in different organs. And actually, Adriana Abuelo and previous speakers have mentioned the fact that histamine in the diet may foster alterations even in the central nervous system. But how is that? How may histamine provided in the food induce migraine in the central nervous system? Well, the answer is very clear. We don't know. We don't know, but there are grounds to establish a scientific hypothesis. I think that the knowledge that we have currently may allow us to create a theory based on fact as to what is DAO doing to protect us possibly from a migraine attack. And that's what I'd like to share with you if I'm allowed to. I'd like to tell you how this university and the University of Erlangen in Germany are trying both together to understand the mechanism by which histamine causes migraine. So, well, we talk about diamine oxidase, DAO, so we should be introduced to DAO, right? There it is. This molecule, this compound, is human diamine oxidase. Obviously, you don't see it here. It's a fairly big molecule, which is located in many different places. One of them being the villi of the intestine. There's a large amount of diamine oxidase in the enterocytes, in the intestine. Well, obviously, you can't see how big this molecule is, but I can show you just for reference. How would aspirin look like, right compared in terms of size and in terms of complexity? Diamine oxidase is a molecule that was discovered like 100 years ago, a bit less than that, probably. But that may bring novel advantages in clinical practice. Old molecule, potential new tricks. So to put things into context, if I may, let me say something that you all know. What does diamine oxidase do? It does different things, but above all, what it does, it degrades histamine. It's been said by Diana and by other speakers. It essentially inactivates histamine. There are other ways to inactivate histamine, but DAO, diamine oxidase, is probably the most relevant one, both for exogenous histamine and endogenous histamine. So how can histamine that may be provided within the intestine provoke a migraine in the central nervous system? Sounds like a very difficult connection, right? Well, let me try to convey this by addressing three things. Let me first go to facts on histamine. And, you know, histamine is also a very small molecule, so-called autacoid, which is derived from an amino acid, L-histamine. And I won't get into many technical details, but this is essentially histamine, very simple molecule, which is, as I said, catalyzed, degraded, metabolized by diamine oxidase into certain pieces, and that essentially abrogates its activity. Now, why do we have DAO? What is histamine doing to us? Well, we could, and that has been addressed earlier on by Dr. Vidal, we produce histamine. We do have mast cells and basophils in many organs that produce histamine. So there's an endogenous source of histamine. And we know that this histamine may cause harm, notably allergies. When you have this rhinitis, allergic rhinitis, what this is essentially a release of histamine that is acting on the blood vessels and provoking edema. So we know basically the harm produced by endogenous histamine. And we know that histamine may have physiological roles as well. But there's a source of histamine, as has been said, from the outside. Food can bring loads of histamine into the intestine, into the gastrointestinal system. Food and bacteria, they both can cooperate to generate a lot of histamine or a high histamine concentration in the intestine, the gut. Now, what does DAO do? Well, it probably has a protective effect. It is expressing the villi from those enterocytes. And when there's a lot of histamine coming with the diet, a high release of DAO is generated, and that probably neutralizes histamine activity. Obviously, if you have DAO deficiency, you may be in trouble because you're not able to neutralize, to inactivate all that histamine. Now, histamine does a lot of things, but there's been a connection published in different papers, not many, but some of them, about a potential role for histamine in migraine, in headache, in migraine attacks. This picture here on the left says that our central nervous system produces histamine. We have mast cells in there that may release histamine, provoke neurological inflammation, and possibly generate a headache. So that's something that we know. Mast cells are in the pure matter, are in the brain, are in the central nervous system. That's a very important fact. Maybe more importantly, some papers have described very early on, this is from 2003, that in certain conditions, some patients may have increased levels of histamine while suffering from a migraine attack. So you see, there's a functional connection that may be linked there between histamine and migraine. Now, the question is, what histamine is causing it? Maybe exogenous histamine, maybe the histamine that is brought into the intestine through food. Could this actually generate alterations in the central nervous system? Well, I mean, we don't have a clear answer, but we know some things, and I think previous speakers have mentioned. Well, we know that histamine, when it's in high concentrations within the gut, within the gastrointestinal system, may cross the gut barrier and go into the blood. So we can easily look at histamine levels in blood, and when you feed a rat, for instance, with histamine, you will see that the blood levels of that compound will increase. So that's something that we know. Histamine may go into the blood. And the previous pictures showed that when you have a migraine attack, you may have increased histamine levels. Is there a cause-effect relation? We don't know. But we know also, and this paper has been cited earlier, that supplementing patients with migraine with diamine oxidase orally may prevent those attacks. We need to work on that, and we've seen some ongoing trials, but that may prevent migraine attacks. So again, this is external histamine. We're providing oral diamine oxidase, which is not absorbed, and that seems to prevent the occurrence in those migraines. All right, so I think that there are grounds for considering that histamine from different sources, including the diet, the food, may to some extent generate issues in the brain, in the central nervous system. But there's a connection that we're missing there. There's something in between histamine and migraine that should be explaining that. And I think the missing link may be a compound, a small molecule called calcitonin gene-related peptide, CGRP. Let me tell you why I think this may be a missing link. And for that, let me try to put into context that indeed CGRP is a relevant molecule in migraine, and indeed histamine may be functionally connected to CGRP. Why do I say that CGRP may be relevant to migraine? Well, I say that because of three facts. The first is, we know that the intestine, what we call the nervous system of the intestine, has the ability to produce CGRP. So we may be able to find CGRP in the intestinal wall. It is a neurotransmitter released by CGRP-ergic neurons that may be released in the intestinal wall. So that's one important idea. The second idea is that CGRP is able to produce neuroinflammation. You see this on the screen. This is the CGRP peptide. It's a fairly small peptide, it's a fairly small molecule. So that you have an idea, this peptide has 37 amino acids. Diamine oxidase has 750 amino acids. So there's a big difference in terms of size. And this is a small peptide. Right? But we have seen that some patients suffering from migraine have an increased level of CGRP in the jugular vein, for instance. And we know the CGRP is in a position to produce meningeal vasodilation and to stimulate or sensitize nociceptors, that is, receptors for pain. And certainly this may have as a consequence the development of migraine attacks, a neurogenic inflammation. So we know CGRP is located in the intestine. We know CGRP can cause a neurological inflammation. And third, and very importantly, and you may understand that for me, a pharmacologist, there was a key evidence or a key piece of evidence. If you block CGRP activity, you reduce migraine attacks. Not too long ago, a few years ago, there were antibodies, molecules that have the ability to recognize CGRP and to neutralize its activity. And that certainly has a clinical impact into reducing migraine. And this picture, you see a paper that addresses those issues. And you see this drug, which is in fact the drug that has the ability either to bind to CGRP and prevent it from acting, or to bind to the CGRP receptor, fremanezumab and elranatamab. So all in all, this tells us that CGRP is relevant to migraine. And this is, so to speak, an officially established. There's a drug that has been approved by major regulatory authorities that is telling us that CGRP inhibition may reduce migraine attacks. Now, so what? You may ask. We have histamine related to migraine. We have CGRP related to migraine. In the first case, it's not such an established connection. The second, it is. The important fact, or the interesting fact, is that CGRP and histamine may also be functionally related. This is just a picture. I don't want you to go over this. This picture essentially tells us, from a paper in 2007, that you can co-localize in the same neuron, in the same cell from the central nervous system, histamine and CGRP. And that's an important piece of evidence. But more, we can see that CGRP antagonists may inhibit histamine-induced hyperalgesia in certain models, or even more, CGRP induces histamine release from mast cells. So there's a functional connection between CGRP and histamine that works both ways. And this paper summarizes all that. this paper tells us that CGRP may induce histamine release and histamine may induce CGRP release. Quite interesting, because we have three pieces of evidence, and we can recap. There's a plausible association between histamine and migraine. There's an established association between CGRP, calcitonin gene-related peptide, and migraine. And there's a probable functional connection between histamine and CGRP, a positive correlation, more histamine, more CGRP likely. Well, let's put those pieces of the puzzle together and see what comes out. And that's my last part of the talk. Well, let's consider that we take or intake high levels of histamine in the diet. Now we know that in the intestinal wall there are neurons that bear CGRP, so this may very well stimulate what we call afferent neurons bearing CGRP. So there may be a direct activation of neurons in the wall of the intestine, and those neurons may be bearing CGRP. That's one potential path. The second would be that CGRP may liberate it into the plasma and also stimulate those neurons, or histamine may go into the plasma and stimulate those CGRP-ergic neurons. And those neurons may bring the stimulus, the activation, to the so-called trigeminovascular plexus, which is close to the brain, not quite there, but close to the brain. So there's a potential connection to stimulate these neurons. And in this trigeminovascular plexus, CGRP is released, histamine may be released, likely in the layers of the brain, the dura mater, and those two mediators may generate inflammation in the brain and cause a migraine attack. This is a field. Well, we need now to look at it, and we will. So the hypothesis is that exogenous histamine, CGRP, and neurogenic inflammation may be connected, and maybe a migraine mechanism. Now, if we have diamine oxidase deficiency or lower expression, this mechanism may be uncontrolled and may be activated. So this would tell us that in patients suffering from DAO deficiency, what may happen is indeed that histamine is stimulating somehow CGRP release and causing migraine attacks within the brain through stimulation of neurons that are connected through the trigeminovascular system to the intestine. Well, this is a complex issue. This can't be studied in the patients. I think the clinical trials that are ongoing are very interesting, but we will do some studies, probably in mice, to see if our theory, if our hypothesis has certain scientific grounds. Thank you very much. It's been a pleasure.